Hi everyone, Lisa Haven here. Well, the mainstream media has been constantly lying to you. They lied about Ukraine, they lied about Russia, they lied about net neutrality, they lied about Brett Kavanaugh, and the list goes on. And now we're supposed to magically believe them about everything that they're saying about the coronavirus? I think not. In today's report, I'm going to reveal some facts that the mainstream media says we should all panic about and all have a conniption fit over, so to speak, when in reality, I'm going to show you the truth of what's really going on. Everything from hospitals, are they overwhelmed? I'm going to address that issue, as well as are the numbers adding up? All those predictions of millions of people dying, will they actually come to fruition? Well, you're going to find out some interesting information. But before I do, I want to give a quick shout out to my partner at healthwithlisa.com. This is something I take on a daily basis and I mix it in my coffee. You can mix it in hot or cold fluids. But this is amazing collagen. And as you can see, it's through BioTrust, but it's got 5 separate types of collagen. So I want to encourage you guys, if you want to build your collagen up, check it out. It's called BioTrust, but go to healthwithlisa.com. All right, so let's start first with what's going on with hospitals. Did you know that hospitals have had major issues all throughout history of being overcrowded? Did you know that a thing like the normal flu can already overcrowd our hospital systems? In other words, it doesn't take very much. Take a look at this article here on healthleaders.com. 2/3 of United States hospital beds are already occupied. The report states, the report shows that bed availability per 1,000 people varies a great deal across urban and rural areas, states, and counties across the nation. The analysis estimates that the United States has 728,000 medical and surgical hospital beds available to the public, 2.2 hospital beds per every 1,000 population. However, only 36% of these beds were unoccupied on a typical day, leaving just 0.8 unoccupied beds per 1,000 people. That's less than 1 bed per every 1,000 people. What does that mean? That means exactly what I've been saying, that hospitals are very easily overwhelmed. If you have an outbreak of measles or an outbreak of chickenpox or an outbreak of the flu or an outbreak of the coronavirus, then naturally your community hospital will become overwhelmed, no matter what is striking your community. And these are the facts coming from healthleaders.com. These are real statistics. And the truth of the matter is, people think, oh, well, we're trying to stop all the overwhelmed hospitals. Well, let's take a look through history and see how many times this has actually happened. And it turns out there's thousands of articles about it, but I'm just going to share a smidget so you get the idea, and I'm going to go through them fast. Here we go. Dailynews.com, October 2018. These are before coronavirus. Overcrowding at Montefiore is a bitter pill to swallow for nurses and patients, and that's located in New York. 48hills.org, November 2019. Opinion. Is San Francisco General Hospital ready for a disaster? I fear not. A trauma nurse explains the dangerous staffing shortage at the region's only level 1 trauma center. TheOlympian.com, November 2019. Providence St. Peter Hospital needed more patient beds. Why did it take so long? TheGuardian.com, December 2019. Nurse shortages focus NHS hospital to shut critical care beds. WUNC.org, October 2017. Opioid epidemic strains hospital emergency departments. TheGuardian.com, December 2017. Desperate times for overcrowded hospitals, senior doctor warns. ACLU.org, August 2017, overcrowding in Nebraska's prison is causing a medical and mental health care crisis. TexasTribune.org from 2018, flu patients leave Texas hospitals strapped. Widespread flu activity has left hospitals overwhelmed with patients, but high emergency room volumes and filled hospital beds are not uncommon for this point during the flu season, state officials said. ThePatriotLedger.com, January 2020, flu causes overwhelmed South Shore Hospital emergency room. Now, all of those happened before coronavirus went spreading viral here in the United States of America. Those articles range from 2017, 2018, even I think there was earlier in there, but from all the different years, and pretty much like clockwork, every flu season, we have overwhelmed hospitals. So what is all this huss and fuss from the mainstream media? Do they have a deeper agenda? And I'm not going to be quiet about any of this any longer. We need to start reaching out to people that we know on Facebook, to our family members, to our friends, and start sharing data like this. Please share this video with everyone you know, because we need to get down to the facts. And look, all the information that I talk about is in the description box below so you can see it. But you know what? We're not living in an apocalyptic war zone right now. And according to some sources, they're not even crowded right now as far as, well, the New York hospitals aren't even an apocalyptic war zone right now. Take a look here at this article by ToddStarnes.com. New York City is not an apocalyptic war zone, contrary to what Democrats and the mainstream media are broadcasting. In fact, Todd Starnes has been calling the hospitals there in New York and asking them some questions. Take a look at this tweet here. He says, our team has been reaching out to verify conditions at New York City hospitals. Do they have enough beds? Do they have enough ventilators? Are they turning away patients? NYU refuses to answer, and they will not go on record. Why not? Why not? They're refusing to answer simple questions. But hey, there's also a senator out there, who's spreading fake information. Take a look here. Here's Ryan, and I can't say his last name, but he retweeted something by Ted Lieu, who's pushing fake news about hospitals and ventilators in the Midwest. And you could see, he says, Democrat Representative Ted is promoting this completely false and already debunked claim. What's the claim? Hospitals in the Midwest have reached their limit on ventilators. Not true. Not a true claim. Why would Democrat senators, give in to this panic and spread lies? Well, I think that's a question we need to start asking our senators, the ones who are doing this. This is the question we need to start asking the media. Maybe we should figure out what's truly going on. And a lot of you who watch my channel are well aware this is the globalist card. This is their card, not only to get rid of the ideas of nationalism, patriotism, and capitalism. They want to kill capitalism, but to spread so much fear. And the American public is on steroids fear. If you're not on Twitter, join and follow me on Twitter. Help me spread truth so we can start getting the real words out. You know how many people attack the president and everybody else on Twitter because they're troll farms? Please join Twitter and help us start educating the masses. I, for one, about a month ago, I believed in the panic. I thought this is really bad and a lot of people are gonna die and millions are gonna be dead. That's what I thought. I was wrong. I opened up my eyes and looked at all the information and said, you know what? This whole thing is a sham. And it's not a sham, it's real, right? The virus is real, 100% real. It kills people. But it's similar to that of the flu, and they're using this as an agenda. How do I know this? Well, take a look here at thegellerreport.com. Dr. Fauci, in New England Journal of Medicine, coronavirus is less severe than the flu. Wait, is that the same Anthony Fauci that goes on TV with the President of the United States? Absolutely it is. Oops, we're just a little off here. Or how about this? How about over in the United Kingdom, right? They downgraded coronavirus. They said it's no longer classified this highly disease, right? They downgraded it. And in addition, they also threw this little number out on WashingtonExaminer.com. Imperial College, by the way, those are the same ones that I broadcast on a week ago saying that their numbers are fabricated. Well, it looks like the UK caught on. But so is the US, right? Here it is. Imperial College scientist who predicted 500,000 coronavirus deaths in the UK just adjusted it to 20,000. We didn't mean 500,000 deaths in the UK after you locked your country down. We only met 20,000. Oh, but that's because you closed the country. The United Kingdom had their country shut for 2 days. And then suddenly they go from 500 to 20. Wait, it's almost as if Imperial College is run by Democrat activists. Oh yeah, that's right, it is. And if you want to check out that, watch my video a few days ago talking about the numbers being highly fabricated. But hey, at least we're catching on here in the United States as well. Take a look at foxnews.com. Dr. Deborah, the one that has been coming on TV with the President of the United States, says coronavirus data is not matching these extreme predictions. It's not matching these extreme predictions. Why? You see, H1N1, right? Let's just, and I wrote this on my Facebook page, so I'm going to reference that, but H1N1, from April 2009 to April 2010, infected 60 million people, 60.8 million in the US. Infected 60.8 million people. It caused 274,000 hospitalizations and about 12,500-ish people died in 1 year. But tuberculosis, let's talk about tuberculosis. Tuberculosis in 2017 killed 1.6 million people. Where was the outcry then? We have to start getting all our information together and put it out there for the public to see. If we don't wake it up, this panic is going to eat the country alive. And guess what? We're going to head into something worse than a Great Depression. Worse. And it's going to lead to the deaths of more millions of lives. Talk about overwhelmed hospitals from coronavirus. You ain't seen nothing by the time that we get to the economic depression. Nothing. But it's like you just want to make the cure worse than the actual pandemic. Anyhow, I'd love to get your thoughts, comments, and concerns. I really want to encourage you. Start joining these platforms. Start educating the masses. Encourage them to join sites like this, to get on YouTube, to have the real information. But better yet, even use the links in the description box below. Send it to people directly. We have to wake people up. We can't remain quiet anymore. Our country is going to die. As in, I'm talking about an economic death, like we have never witnessed before, like we've never seen before. I don't want that over something with a mortality rate similar to that of a flu. No shutdowns over H1N1, no, which was a new virus, by the way. People want to compare apples. There's your new virus. Tuberculosis. Oh, there's a cure. Well, then why did 1.6 million people die of it? And technically, our own bodies can fight the coronavirus, and most of us go away just fine. So, hey, you can compare the two, right? Please, please, please start speaking up. Don't remain silent. I love every single one of you. Call your congressmen and senators. Let them know this information. Thanks again for tuning in. We're in this together. I love all of you. I'm Lisa Haven, signing out.